Here is an easy way to learn the anatomy of the Achilles tendon. The Achilles tendon is located in the posterior ankle. The Achilles tendon is the strongest and the thickest tendon in the body. It is formed from the soleus and gastrocnemius muscles. The Achilles tendon is inserted into the calcaneus bone. The subcutaneous calcaneal bursa is found superficial to the Achilles tendon. The bursa lies between the skin and the distal aspect of the Achilles tendon. There is also a subtendinous calcaneal bursa located deep to the Achilles tendon. This bursa is located between the Achilles tendon and the calcaneus. Inflammation of one or both of these bursa can cause pain in the posterior heel or ankle. The Achilles tendon is prone to tears and rupture, and most Achilles tendon ruptures occur above the calcaneal insertion of the tendon. Like all tendons, the Achilles tendon does not have great vascularity. The watershed zone is the part of the tendon that has the worst blood supply. This is a very narrow area in width between 2 to 6 centimeters proximal to the calcaneus. The Achilles tendon is prone to tendonitis or tendon ruptures within this watershed zone due to limited blood supply. When the Achilles tendon ruptures within this narrow area, the result may be similar to pulling apart a rope. This injury is often referred to as the weekend warrior's injury. The injury typically occurs from overperforming or overdoing a physical activity. The injury also occurs more in men aged 30 to 40 years. The mechanism of injury for rupture of the Achilles is usually from eccentric loading on a dorsiflexed ankle with knee extension. My left leg feels alright, but my right leg is giving me problems. And I can't stand on only one leg. Hello, doctor. I think I hurt my ankle and I could really use your help. Could you examine me? I think I'll record this and send it to the doctor.
This video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.
The Achilles tendon is the thickest and strongest tendon within the body, although occasionally it is exposed to stresses which make it susceptible to injury. Injuries to the Achilles tendon commonly occur when forces placed on the tendon exceed its tensile limits. The Achilles tendon is a strong, fibrous cord that connects the gastrocnemius and soleus muscles to the calcaneal tuberosity. Common causes of injuries to the Achilles tendon include repetitive or sudden increases of stress placed on the tendon, an increase in exercise intensity, not allowing recovery time between exercises, decreased range of motion due to tightening of the calf muscles, and bone spurs which cause rubbing against the tendon. The two most common types of injury to the Achilles tendon include Achilles tendonitis and Achilles tendon rupture. Tendonitis involving the Achilles tendon is painful and often debilitating. Chronic inflammation of the Achilles tendon is due to stresses, micro tears, and is also a result of inflammation and scar formation. Achilles tendonitis may lead to pain in the back of the heel, occasional swelling due to thickening of the tendon, and often occurs in athletes such as runners. Treatment of Achilles tendonitis includes anti-inflammatory medications, physical therapy utilizing the active release technique, massage therapy, ice therapy, immobilization, and injections. Techniques for injection often include prolotherapy, platelets, and needling. Techniques for injections are performed with or without ultrasound guidance. However, they are still within the investigative phase. It is advised not to inject steroid directly into the tendon. The goal of treating Achilles tendonitis is to reduce stress on the tendon. In rare or resistant cases, surgery is sometimes needed. Rupture of the Achilles tendon can be either partial or complete. A rupture of the tendon may occur suddenly, without warning, or as a result of tendonitis. The patient will often feel or hear a pop in the ankle when the tendon ruptures. This is followed by the presence of sharp pain in the back of the ankle. As a result of the tendon rupturing, the foot may become floppy and weak. And finally, the patient feels as if they have been kicked in the back of the ankle where the tendon has ruptured. The Thompson test is a clinical evaluation test used to assess the integrity of the Achilles tendon. With the patient lying prone on the examination table, the examiner will squeeze the calf muscles of the affected leg. Slight plantar flexion of the ankle is a normal response to this examination when there is no presence of a rupture. However, if the Achilles tendon is ruptured, there is no plantar flexion or movement of the ankle in response to squeezing of the calf muscles. Surgery is done by exposing the torn tendon through an incision in the skin. The ends of the tendon are cleaned and approximated. Once the tendon has been cleaned, repair of the ruptured tendon can be done with sutures. The Thompson test is once again performed to check the integrity of the Achilles tendon after repair. A cast or splint is used for 4 to 6 weeks post-operatively, then physical therapy is initiated.
This video is for educational purposes only. Please consult your doctor before you make any decision about your medical care. This video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.